So already we reach a turning point. Some people will experience such extreme repulsion and fear simply at the mention of a list of diagnostic labels that they spiral into paranoid alarmism marked by a terrified clinging to what is familiar to them. With their present levels of cognitive function, neurological abilities, and overall health, they may remain in the stage of practice that I call focusing on effects rather than on causes. That first stage of panicked alarmism, paranoia. So rather than promote optimal health, they may agonize over how to battle against symptoms, such as arthritis. They may speak of their diagnosis as something that has possessed them. They may say that they have arthritis. They may even say, my arthritis is making my joints hurt. My arthritis is making my joints hurt. That, however, is illogical nonsense. Arthritis is merely a label for symptoms. It is not a demon possessing them and causing them symptoms. It's a label. It's a label for an effect. It's a label for symptoms. All diagnostic labels are just labels for an effect or a symptom. So, many people worship diagnostic labels. They give immense attention to diagnostic labels. And some of these labels they understand so little that they call them incurable conditions. What does incurable mean? When someone says that's incurable, that means they personally do not comprehend physiology enough to know how that condition formed and what to do about it, how to relieve it, how to prevent it, etc. When cures for conditions that have previously been called incurable, when cures or remedies or recoveries are announced, some people may dismiss those initial reports out of shame at their lack of comprehension of physiology and health, which has been suddenly exposed by the consistent curing of what they have previously labeled incurable. They relate to diagnostic labels not as effects, but as causes. Rather than worship health or study health and promote health, they worship disease and diagnostic labels for disease. They worship effects, not causes. They produce or they practice the behaviors of paranoia, agonizing, and alarmism. I'm calling agonizing, alarmism, and paranoia behaviors, choices. They're not effects. They're behaviors that people can do or notice and discontinue, or notice in others, etc. So by practicing the behavior of agonizing, people can produce an emotional agony that is distinct from the original diagnostic label, which they have been worshiping as a demon, such as arthritis. So I have my arthritis and it's causing me pain in my joints, and then I attempt to suppress my body's pain signals, the pain signals that are telling me, whoa, there's something to be done differently. And instead of doing things differently, I simply add whatever I add, as if my body had a deficiency of, I don't even know what people take, anti-inflammatories. Now, that's interesting as an example because there are things that reduce inflammation that it's good for the body to have a lot of, such as antioxidants. But there are also things that like antihistamines that are relatively common that people are taking not to promote healing, but to suppress the functioning of their immune system. Sometimes that can be a very good short-term intervention in an emergency, in a crisis. Typically, things like antibiotics and other things that are suppressing immune response will lead to more and more serious healing crises, more and more serious immune responses. The immune system will not just give up because you take cough suppressants and antihistamines and antibiotics and so on. Life continues to attempt to thrive. No matter how much sterility medical science attempts to impose on an organism, there will still be vitality surging forth from the depths, sometimes weakly, sometimes very powerfully and suddenly. So diagnostic labels like arthritis are what some people can worship and agonize over because they don't know any better. Rather than study and explore the causes of health and the causes of a condition, they can panic. They can agonize over a diagnostic label that they're worshiping and produce additional agony separate from the physical pain and limitation of movement that we could call arthritis or inflamed joints. Many people worship the demons, which most mainstream physicians also worship and teach others to worship. So there's an alternative to all of that. As I mentioned at the very beginning, some focus not on combating a label that they worship in terror and panic, but instead on promoting health. I don't mean blaming some government for reducing the health of a population. Governments systematically orchestrate massive campaigns of violence, whether it's Sweden or the US or, a 1,000-year-old, the Confederate States of America that's been gone for a long time. It doesn't matter what government we're talking about. All governments systematically organize massive campaigns of violence. Even Switzerland, that doesn't have an army, still has a police force. Massive campaigns to threaten or carry out violence. So anyone who's surprised to learn what I just said is simply not already familiar with the history of governments. Fine. But I just want to make this note because a lot of people who are exploring what they would call holistic medicine or holistic health, they may get caught up in criticizing and condemning government programs. And again, there may be a time to do that through lawsuits or whatever means. But ultimately, blaming anyone, condemning anyone, is no substitute for promoting health. The actual activity of promoting health, to me, is by far the priority. Not only do governments systematically conduct violence, but they also protect the business interests of whatever groups exert an influence on the policies of that government. That's understandable. We could say how governments are supposed to work. We might not like a particular outcome, but governments are for governing. They're for influencing people and for promoting certain things and discouraging or punishing certain things. That's what they do. So if we dislike the way that they're doing it, fine. Number 1, promote health. Number 2 or 3 or 4 or 7 or 23 or whatever, campaign for governments to be more open to science and to discontinue the wars on science, to stop promoting the worship of demons. And good luck. So while Dr. Terry Wall, up here on the screen, might at some point campaign for various kinds of political reform, first she produced her own recovery. She promoted her health as the priority. Then she produced consistent recoveries in patient after patient, in fact seeking out patients with the most severe problems and thus presumably with the most motivation to change.